Okay, here we go. All right, so today in this meeting for transformation, we are doing training number 6. And this is really an expansion on one of the other modules that we have already gone over. And that is, and we're going to talk about team-based care. So this is our disclaimer. We've gone over this before. So what we're going to talk about today is knowing that team-based care leads to better outcomes for patients and better experience for the staff. It's very effective to improve all parts of the care delivery. It creates a positive effect on office visit cycling time, access to care, preventive screening, self-management with patients, goal setting, action planning, and also as well, medication reconciliation. So implementing team-based care you'll work with it, especially with improving work processes, workflows, making sure that all your staff members that you have in your office are working to the top of their licensure. So we're making sure that we're using them to the best of their abilities. And then we're sharing accountability for care delivery. This sharing accountability for care delivery might be a very challenging aspect, but well worth it. Okay, here it goes. Also, the responsibility for this care delivery in team-based care lies with the providers, and it also will rely on providers being comfortable shifting responsibility to other team members. And that can be challenging because it's hard to let go sometimes. But as we talked about before on multiple training sessions, we have to start with those small steps, those baby steps. And sharing responsibility might require a type of culture change in your practice of both the clinicians and the non-clinical team members, because it's going to be something new for you to do. So the first thing first module, getting started module, in that module, we talked about implementing team-based care, but now we're going to talk about how to do a little bit more advanced steps for enhancing your team base. Now, many of you, I'm sorry, just one moment. Can everyone else see the screen, Dr. Deshpande?
I'm not seeing the screen. I'm like, I can hear you.
I understand. Is everyone else?
I can see the screen.
Okay.
We cannot see the screen. We cannot.
Dr. Deshpande, we did send out a paper, an email with the presentation that you could follow along listening to me, but look at the presentation that I sent. Okay. So, all right, so let's talk a little bit about change concepts. So for each of the change concepts that we've listed below, there are different change tactics that have been identified that represent that a practice has successfully implemented. So one is collaborating with those patients and their families. And then in family engagement, that will help with these change concepts. Also, team-based relationships. So enhancing your teams. clarifying those team roles and optimizing continuity will help with the change concepts and help with those tactics to start this process with team-based care. Also, community collaboration. So we talked about practice as a community partner and coordinated care delivery, opening up and getting ready and establishing those medical neighborhood roles where you have multiple people in multiple practices. You have maybe some support out there, maybe some different medical neighborhood support roles, maybe having a diabetes support group or congestive heart failure support group out there. So we want to expand and strengthen this team. Now, if you don't currently have a team, if you only have two people can be a team. Multiple providers can be a team. And keep this in mind for future as your practices grow as well. So additional staff can really strengthen that care team. So a lot of transformation practices, for example, have found it useful to integrate a pharmacist, a behavioral health specialist, a diabetes educator, or a health coach into the care team. Now, Lisa, you are part of nutrition and dietary issues, and maybe getting to be part of a team with a primary care office would be a way for you to actually promote your practice, but also help care teams for primary care. Okay. So that's a way to put those medical neighborhoods together. So also think about your huddle and your processes and your communication in your organization, and maybe consider adding others to the care team that might improve that communication. I know it's expensive to hire a new person. I was on the call on Monday. I was talking to someone about possibly getting a medical assistant in your practice by doing an externship with a medical assistant. And that way you have this person in your office for 6 weeks. You can train them, you can help them, and possibly hire them on a part-time basis once they finish their externship. So there's lots of different ways. You can get a grant sometimes to add a different person to your practice. Maybe contact the local colleges, and maybe there's a program that they have where they're doing some kind of maybe secretarial program in their career enhancement program. And maybe you could get one of those people to come in to learn, but also help you in your practice. So making sure you revise your workflows and map out the roles and responsibilities of all the care team members is really important. So those new staff members might provide an opportunity to actually redesign those roles and those responsibilities, because you're adding new staff and adding, redistributing the responsibilities. Also encouraging all your team members to attend those daily huddles while allowing flexibility to accommodate those schedules and the needs of the patients. If you have a handicapped patient coming into the practice, you might need to think about in the daily huddles, how are you going to accommodate that patient? AMA has steps forward, so they have embedding pharmacists into the practice. And that is a link that you can click on. You can also click on the AHRQ, which is Integrating Behavioral Health Playbook, and it contains a lot more information on adding roles to your team. Maybe give the teams a designated time to develop relationships, team building sessions. and putting on different activities through through your units of the team. Think of site and care team space. So maybe like colored flags on rooms that you can give a way to communicate with your team. Also, you could enhance the care team, making sure you have effective coordination for that. Expand the concept of the care team to include individuals, all the individuals who interact with the patients and their families, even if it's indirectly. Locate your team members to improve communication by providing some kind of line of sight among the team, so everybody gets to see part of the team. Using those multidisciplinary huddles for care planning at the start of each morning or each session is very, very helpful. And those huddles, you might use a 5-minute huddle to make a just-in-time adjustment to your schedules. You can also cross-train your staff to enable the practice to adapt to demand of variations, and cross-train the staff to allow introduction of additional services to your patients. Make sure you're maximizing the role of the medical assistant. Medical assistants really don't get the credit due to them, and they really can provide a lot of different services to the patient once they are trained, and you can maximize that by training the medical assistant. When we talked a few minutes before about maximizing and allowing the staff members to be part of this program with the medical, to the best of their licensure. Make sure you're reviewing what a medical assistant can do and cannot do. And you might find that there are valuable services that they can add once they're trained. Some offices tend to use scribes to help the provider have their productivity increase, because they're not always just sitting there typing all the time. And look outside the organization for team members. As I was speaking about Lisa, she's a dietitian, she's a nutritionist. Looking outside for those kind of members, community health workers, peer advisors, medical nursing pharmacy students. One of the practices I talked to was using medical students to scribe so that they could learn about how a practice works. Public health nurses or representatives of community agencies line up with those agencies, maybe a social work office in a hospital, lining up with them that you could send your patients over there to help them get medical assistance so that they can have better services. And add those team members for specific population needs: diabetes educators, podiatrists, HIV nurse specialists, those types of things. And making sure there's a formal approach in your office where you're going to integrate behavioral health, oral health, heart problems and oral health. You might want to integrate that. Contact a dentist, a dental hygienist, a pharmacy or a pharmacist, or maybe a pharmacy tech that could help in the primary care setting, and making those specific relationships. Using your messaging system to communicate among team members. Maybe a team member can text the doctor when this particular patient is ready. That's a good way to get that communication going. Making sure those roles and tasks among the team members are consistent with the team members' credentials, and making sure that they better meet the patient's needs. There is decision support and protocols to manage workflow in the team to meet those patient needs. Managing workflow to address chronic and preventative care. For example, through pre-visit planning or huddles, reviewing those charts a couple days before to see exactly what that patient is coming in for and what you need to prepare for or to talk about in the huddle. And enhancing your resources with the staff, like having a contact with a health coach, maybe a nutritionist, behavioral health person, pharmacist, maybe a physical therapist to meet those patients' needs. and monitor and reward compliance with huddles and team preparation. Make sure you're rewarding your employees and your staff members for noticing that someone might need, a patient may need specific team help. Those team-based relationships. So you're going to need to clarify those team roles, define, distribute, and document all the roles of the care team members to make sure you're maximizing what their skill sets are and leveraging that team, making sure that when you include a pharmacist on your team, they can play a role in medication management, reconcile medication, monitor contraindications or overuse of medication. They may also develop a personal medication plan for each patient. Maybe not a pharmacist, maybe you're going to have a pharmacy tech. They would have different roles and different abilities in there, but maybe you could use them just to kind of go through medications with your patients, try to figure out what's going on, and then address it with the pharmacist. There's always different possibilities. Identify a champion in your practice to help with this team-based, expanded team, and inventory the work. Use those process maps to make sure that you can do that. Assess your staff readiness. Make sure that your staff members are really ready to move forward with this. There is a resource on this screen, American College of Physicians Team-Based Care Toolkit. I highly recommend that you review it. Even if you only get one idea out of it, it will be a good idea that you can move forward with. Every idea is a help to your practice and to your patients. So again, we're going to make sure that we're going to maximize all of this team skill sets. We're going to make sure that we inventory the work to be done prior to the patient visit, during the visit, and after the visit, making sure that those patients are getting their visit summary at the end to make sure that they understand everything that has happened. And again, you're going to clarify those responsibilities of your staff members once they have new roles assigned. And look at the staff's interest and talents and maybe align them with available opportunities. Add fields to your EHR to capture those team member roles so that you can see what they are putting into the system for your patients. Share team roles with patients and families on paper and electronic systems. And again, empower those medical assistants to be coaches to help out. That medical neighborhood is so very important. We've talked about that a number of times. You're going to establish those medical neighborhood roles and establish expectations among primary care teams, specialists, and other medical neighborhood members to make sure that they are going to share with you and you're going to share with them what's going on with the patient. Identifying and collaborating with those community partners will enhance the service offerings and increase patient and family engagement. We all know health is actually a community issue, and the medical neighborhood includes both medical and social supports to manage health. Senior centers can offer seniors who are suffering from loneliness and depression. They can often supply that social support and help the patient to feel better about themselves. And then maybe they find that someone in the senior center is suffering from the same thing and they can use it to talk to each other. So optimizing that care team requires making sure you're developing high functioning collaboration with those partners, those different specialists, the home health, maybe the home health. You might want to work with home health and do a collaboration with them so that you know what's happening with their patients when they're receiving home health, and maybe home health can work with maybe a nutritionist to help the patient when they're at home to get better. Those non-clinical neighbors like your community centers, as I was talking about, also churches, faith-based organizations, they have a lot of different, we have a Bible study maybe that someone could go to meet other people, to get involved in other people. Schools, employers, public health agencies, they all contribute to community health needs. So work with those agencies and make sure you are engaging with maybe churches and schools to develop some kind of joint program. Engage with recreational centers. Make sure that you know the behavioral health crisis response in your community. Maybe there is a behavioral health organization, or maybe the behavioral health organization has some information that might help you help your patient. Maybe work together to have a joint program with community agencies, as I spoke of with the social workers at the hospitals that you go to. Maybe you can get involved with them and develop a program where you can send your patients to them. Talk to the employees about developing some kind of worksite health program. Maybe there's a Saturday, one Saturday every couple of months, you have someone from the community agencies or someone from the medical neighborhood come in and talk to your patients about what they do. Maybe there's a maybe once a month or once every 6 months, you have someone come in and talk about nutrition or talk about behavioral health, and create a document that summarizes the resources that you can give to the patient, and they can use it as a reference to contact those in your community. So you can learn how to contact community partners or make those kind of referrals, or you can develop some kind of formalized relationship. And there are 3 sites here that I recommend that you check on, that you can find ways to make sure that you can do that and collect and organize those community-based resources. So it might be helpful if you could load electronic PowerPoint. So establishing those medical neighborhood rules. So look for clear expectations from primary care specialists and others in the neighborhood, so that you know that you would be able to communicate with each one of them, and that you trust that you're going to get some information from them and you're going to give some information to them. Define that medical neighborhood that the practice works with the most closely, and then look at developing some kind of personal and electronic relationship among them for information sharing, or develop a formal or a written agreement or a contract to make sure that all the needs for each section, give and take, are set up. Formalize lines of communication with them so that you can make sure that that flow of information happens on a regular basis. Make sure that that information is shared with the patients and their families at every transition. And partner with families in developing these processes. Sometimes they might be able to give you more information. Do a survey, do a little team meeting with the patients and ask them, what do you think would help the best? And then also engage in payer disease management or complex care staff to help avoid patient or family confusion about what's covered or what's not. And the payers do have some of those programs, and you can call them and work with them for that. Optimizing that continuity. So both patients and the care team have to recognize each other as partners in care. As the doctor works alongside the care team, they often encounter a number of patients who they've never met before. So with allocated time, they have to learn the patient's history and develop a rapport and address the patient's problem when they're not part of the patient's care team. And seeing the same care team at each visit obviously results in better standard of care, but sometimes there is a time when that's not possible, a provider is on vacation or whatever. So, and also getting them to communicate that. Impaneling those patients or linking them to a care team always leads to continuity. So there's panel management resources that are here on that you can look at to establish those types of things as well. So You're going to measure and monitor continuity between the patient and the care team. You're going to maybe develop a script to assist the schedulers in providing appointment options with their assigned care team as much as possible, and who to assign new patients to an appropriate team. And provide medical record access to provider and care teams who are caring for the patients, maybe after hours or on an emergency basis, or covering for vacations or out of office issues. And make sure you have those, some kind of secure messaging issue that you could go back and forth, maybe from an emergency department, that they could talk to the care team to know exactly what's going on with that patient. And also, you know, assign accountability for the patient to a care team and make sure that there's a coordination going on there. Measuring and making sure that those scheduling strategies are optimizing that care. Making sure that all providers within the practice have access to the same information to guide care, and make sure you have some kind of contingency plan for when continuity is not possible, vacations, out of office, those kind of things. You could create a primary care provider identification card for the patients that they could carry with them through the health neighborhood with all the different resources, or at least if they go somewhere where they're being treated, but you don't know the primary care provider, you can give that identification card and they'd be able to call the primary care and find out more information about that. So you're going to involve these patients and their families on the team, because you want to make sure that they collaborate with goal setting and decision making and any kind of self-management. So including those patients and families in their own care definitely improves the quality and care delivery. So the patient and family engagement will develop a communication with the patient-doctor relationship and create a trust between them. And so you might need to hear their voice. You might need to place patients on those little committees or focus groups, just because you want to make sure that they are giving information to you about how your practice is working, what they see are suggestions, and it creates a trust and loyalty to your practice. And so there are some resources here that you could also look at about patient engagement. We've given these a couple times, but it's always good to keep them and look at them to get some ideas. So you're going to engage the patients to collaborate in goal setting, decision-making, and health-related behaviors with self-management. So you're going to train your staff in motivational interviewing approach. You're going to talk to them, get the patients motivated, and ask them for information about how did you do with your self-management for the last 3 months since you haven't been here. Create a shared care plan for every patient. Use some evidence-based decision aids to provide information about risk and benefits of the care option. Share test results along with appropriate education about the implications of those results with patients. I was at my cardiologist the other day, and he had a little diagram about heart disease, and he was drawing pictures and telling me and educating me about what I need to do and what I don't need to do and where my cholesterol needs to be. He was drawing a picture of arteries with plaque in it and those kind of things. This is really important, and it's a great way for the provider to get a really good relationship with their patient. And making sure that you are using evidence-based techniques to do self-management. Making sure you're using, we talked last time about teach back. This was what my cardiologist was doing. He was giving me information, he was asking me information, and then he asked me what I learned from him. So I got that teach back because I regurgitated to him what I learned from him. So there is a tool called the Patient Activation Measure that you can click on at your leisure to go through that as well. Maybe there's a visit agenda with the patient before the visit. You know, if you have that little huddle or you're reviewing the patient's chart prior to, you may teach your medical assistant to do this, to make a little sticky note and say, last time you talked about diabetes, last time you talked about diet, last time you talked about cholesterol. And then when they come back in, you'll say, well, how did you do with the suggestions I made in the prior visit? They will be impressed you actually looked at that and you reviewed that. Provide some coaching between visits with follow-up on care planning goals. Provide some peer-led support for self-management. Maybe have have a diabetes support group and have each of them help support each other with that. Maybe provide some group visits, as I said, for diabetes, for those common chronic conditions. Looking at specific chronic self-management support groups or coaching or linked to programs in the community. Train your staff to help the patients learn how to do self-management goal setting, and train your staff how to do that with your patients. So you're not doing it with your patient, but your staff is doing it. Standardize your action plan and follow-up processes. Also, educate the patients and families on health transformation. Say, we're transforming our practice. We're trying to be much more involved in our patients and help our patients. And make sure that the patient leaves with their plan of care in hand so that they can refer back to it, because sometimes when you're in the doctor's office, you get nervous and you forget things, but you'll have it when you get home. So this is the end of this presentation. And of course, now we can learn about peer learning with your peers. Does anyone have anything that they wanted to say about this process or discuss with this process? Nobody? Did I put everybody to sleep? Okay, well, if we don't have any, then we can go to the chat box and do the attestation for today. It's in your chat box.
Darlene, I'm sorry, I don't see anything in the chat box.
I'm putting it again because I think it's at the very.
Okay. Oh, thank you. I see it.
Thank you.
Yes.